Hello, my name is Latossia Clark. I will be presenting to you diabetes in the African American community. I will be discussing what is diabetes, the major types of diabetes, the causes of diabetes, signs and symptoms, who is at risk, diabetes facts, how to manage diabetes, and what can I do as a health educator. Diabetes in the African American community. Diabetes can be a lawyer who has a fear of going blind. Diabetes can be a father who one day hopes to walk his daughter down the aisle but has a fear of losing his limbs. Diabetes can be a child that has a fear of going to a sleepover due to frequent urinations and bedwetting. Diabetes can affect anyone at any given time. African Americans are 77% more likely than whites to be diagnosed with diabetes, and 1 in 4 African American women older than 55 have diabetes. I too am an African American woman who's very concerned about not getting diabetes. Diabetes complication. Some complications associated with diabetes are blindness, kidney disease, and amputations. Diabetes is associated with an increased risk for a number of serious and sometimes life-threatening complications, and certain populations experience an even greater threat, for example, African Americans. African Americans are 2.6 to 5.6 times as likely to suffer from kidney disease. African Americans are almost 50% as likely to develop nerve damage, which can cause blindness. African Americans are 2.7% as likely to suffer from lower limb amputation. What is diabetes? Diabetes is a disease in which the body does not produce or properly use insulin. Insulin can be defined as hormones that is needed to convert sugar, starches, and other food into energy needed for daily life. Major types of diabetes. Type 1 is when the body failure to produce insulin. Type 2 is when the body fails to properly use insulin. Gestational diabetes occurs during the second and third trimester of pregnancy. Prediabetes occurs when the blood glucose level are higher than normal but not high enough for type 2 diabetes. Causes of diabetes. Genetics can be one cause. Environmental factors. These are certain things that can cause diabetes due to environmental factors, such as obesity, lack of exercise, eating too much fat food, or too little carbohydrates and fiber. And high blood pressure can also be a factor. Some symptoms of diabetes can be frequent urination, excessive thirst, extreme hunger, unusual weight loss, increased fatigue, irritability, and blurry vision. Who is at a higher risk? African Americans, Latinos, Native American, Asian American, and Pacific Islanders. Diabetes facts. 23.6 million children and adults in the United States have diabetes. Mississippi ranked the second highest in the United States. African Americans are 77% more likely than whites to have diabetes. African Americans are more likely to experience complications from this disease. More diabetes facts. 3.7 million of all African Americans aged 20 or older have diabetes. African Americans are 1.6 times more likely to have diabetes than whites. In 2007, $174 billion was spent on diabetes care and treatment. How can we manage diabetes? Physical activities such as walking, swimming, running, eating a healthier diet such as whole grains, lean meats, fruits, and vegetables, monitoring your glucose daily, medication, education, seeking help from dietitians and other support groups. Can diabetes be prevented? Yes. The Diabetes Prevention Program found that moderate diet and exercise that results in 5 to 7% weight loss can delay and possibly prevent diabetes, especially type 2. Researchers are making progress in identifying the exact genetics and triggers that predispose some individuals to develop type 1, but prevention remains exclusive. A number of studies have shown that regular physical activity can significantly reduce the risk of developing type 2 diabetes. Can diabetes be prevented? Yes. The Diabetes Prevention Program found that moderate diet and exercise that results in 5 to 7% weight loss can delay and possibly prevent type 2 diabetes. Researchers are also making progress in identifying the exact genetics and triggers that predispose some individuals to develop type 1 diabetes, but preventions remain exclusive. A number of studies have shown that regular physical activity can significantly reduce the risk of developing type 2 diabetes. Type 2 diabetes is associated with obesity. What can I do as a health educator? I can teach the African American community that diabetes is a serious, controllable, and preventable disease. I can increase the awareness of the seriousness of diabetes. I can also emphasize the importance of making healthy lifestyle choices such as moving more and eating healthier. These are my references and thank you for your attention.